Do your patients suffer from sensitive teeth, ramping caries, or white spots on the enamel? Now these symptoms can be a thing of the past. Let's hear what our leading dental experts have to say.
For a long time, the best thing that we could offer a patient in terms of lowering their risk of tooth decay was to give them a toothpaste that had 5,000 parts per million fluoride, like Prevident 5000 or Clinpro 5000. But if you really want to heal a tooth, the best thing that you can give it is calcium and phosphate in a very specific concentration with just a little bit of fluoride. And when you do that, you actually supersaturate the mouth with calcium and phosphate, and you allow the tooth to remineralize. And the only product that does that is MI Paste.
Okay, as far as white spot lesions are concerned, we pay a lot more attention to those now, because we know that certain white spot lesions are indicators of active caries activity. So, fluoride can help, calcium and phosphate can help. Fluoride's been helping for a long time. Fluoride can seal over the outside of the white spot and make the outer enamel more dense, more resistant to acid, so that that white spot, which by the way is demineralization, it's subsurface demineralization, it'll seal it on the outside so that it doesn't get any worse. And you know, that's okay, except you still have the white spot. Now we have the ability to not only remineralize it, but to make the white spot appearance go away. And that's what calcium and phosphate can do when they are bioavailable in the mouth. They go beneath the surface. They remineralize the enamel rods that are under that surface, under the surface where fluoride can't quite get to. So they become more translucent and they begin to look like they did originally. So the white spot can actually be removed aesthetically as well as restoring the health of the tooth. So it's a very nice 1-2 punch as far as being able to treat white spots these days.
In my cosmetic dental practice here in Southern California, everyone wants whiter teeth. Unfortunately, for some of those patients that have tooth sensitivity, it makes the process difficult. We've introduced the MI Paste for those patients to utilize both before and after the whitening process to reduce the sensitivity, thus allowing them to have a beautiful white smile they've always desired.
Whether it's the prevention or reversal of unsightly white spots or treating sensitivity, the results are impressive. But how does MI Paste actually work?
Well, fluoride works by actually being a catalyst for remineralization, and teeth remineralize and demineralize constantly throughout the day. If you put a lot of fluoride into the mouth in a really high concentration, you actually don't drive remineralization because you just need a little bit of fluoride to increase the amount of calcium and phosphate in the saliva. What it really does is drive up the chemistry of the saliva so that it can hold more calcium and phosphate. And the more calcium and phosphate that the saliva holds, the more it can release into the teeth and shift the process from one of demineralizing the teeth to remineralizing the teeth. And the protein that's in MI Paste allows that to happen at a very specific pH, at just the pH when demineralization should occur. So it's really a smart, biologically inspired technological molecule.
Well, I'm a registered dental hygienist in alternative practice. And as a registered dental hygienist, I went to school for 4 years to learn the science. The first thing I'm always going to look at is what is the science behind this product? Is it safe for my patient? Is it really doing what it says it does? What are the studies showing? And what are the university level studies showing? The science is there when it comes to MI Paste.
There are products with 5,000 ppm fluoride like Clinpro 5000 and Prevident 5000. Confused? Let's ask our expert.
The easiest way to remember the difference between using a 5,000 part per million fluoride toothpaste and MI Paste is that MI Paste is not a toothpaste. MI Paste is a supplement for the naturally occurring calcium and phosphate that are in the saliva and that are constantly remineralizing the teeth every day. So we're simply adding to that. Toothpaste is used for cleaning the teeth and for exposing them to fluoride. So it's like a brief fluoride treatment as well as a plaque removal. MI Paste, supplementing the saliva, more calcium and phosphate. You do that multiple times during the day and keep that calcium and phosphate boost high so you get an entirely different benefit from one versus the other.
I reserve the use of high concentration fluoride toothpaste for adult patients with exposed roots, or if I want to treat root caries on adult patients. But I think what most people don't realize is that those are toothpastes. MI Paste is something completely different. Your patient brushes with whatever toothpaste they want. Then they apply this topical cream to their teeth. It can sit on their teeth at night while they're sleeping. And the really cool thing about it is that it actually changes the biofilm. And if you want to remineralize a white spot, you have to change the biofilm because it's the biofilm that's causing that white spot.
Recaldin CPP ACP is the key ingredient in MI paste. There are over 140 published studies in Recaldin and MI paste than any other remineralization technology.
I've actually heard certain 5,000 part per million fluoride toothpaste products referred to as MI paste on steroids. And frankly, I think that's just not quite accurate. 5,000 parts per million fluoride toothpaste is just that. Whether it has some additional ingredients in it or not, the main benefit that you're going to get is the fluoride. And listen, it's a good benefit. It's good stuff. That fluoride will make the enamel harder, more resistant to acid. But it just doesn't do also what the MI paste does as well, which is supplement the saliva's natural calcium and phosphate. I teach caries management at UCLA, and I'll tell you, it's too complicated. I wish we did just have a single silver bullet that everybody could use to make it go away, but we don't have that. It's too complex. So we need to attack dental caries at many levels, as far as the therapeutics, diet management, behavior management, all sorts of things. And I'm glad we have these two classes of products to help us out.
Calcium and phosphate are the key building blocks of healthy enamel. MI paste from GC America is like vitamins for your teeth. For a healthier, stronger, more beautiful smile, make MI paste part of your daily practice.